Hello, everyone. Welcome to Webinar Wednesday. I'm Pebbles Turbyville, the CEO for Horses and Humans Research Foundation, and I just want to welcome everyone to our webinar series where we're all about funding research, but also education, letting everyone know how the horse and human interact, as well as making sure that we look out for our equine well-being or equine partners by making sure that their equine well-being is up to par or more than that, really. So I'm excited about this panel today. It's about hippotherapy, and I'm going to turn it over to Lori Rinker, who's our moderator, and she's going to keep us on task. So take it away, Lori.
Hi, everyone. So first, I'd like to introduce our panelists today. We have Lauren Janis, who is an occupational therapist, Bonnie Cunningham, who is a physical therapist, and Beth McCauley, who is a speech and language pathologist. So welcome, and welcome everybody who is here for an exciting discussion. And we're going to start off with Bonnie. She's going to give a bit of an introduction and get us started off on the right foot.
Hey, thank you, Lori. So I thought, or we thought, that it would be good to actually go over the definition that AHA, American Hippotherapy Association, uses as a description of hippotherapy, and I'm going to read it. And it said, the term hippotherapy refers to how occupational therapy, physical therapy, and speech-language pathology professionals use evidence-based practice and clinical reasoning in the purposeful manipulation of equine movement as a therapy tool to engage sensory, neuromotor, and cognitive systems to promote functional outcomes. So that's a mouthful. So I'd like to break it down and kind of hit some key points and some that are actually not part of the description or the definition. What makes equine movement so powerful and hippotherapy for PTs, OTs, and SLPs is right now it's the only tool as therapists that we have where we have three-dimensional movement, but we also move through space. And the moving through space with the three-dimensional movement is unique. So that's the reason it's so powerful. Then to break down a little bit, what does purposeful manipulation of movement, equine movement, mean? It really means that the therapist chooses what the movement that the horse is going to do. Is the horse going to lengthen its stride? Is it going to shorten its stride? As a therapist, am I going to do tight circles, big circles? Am I going to make S shapes, serpentines? Am I going to do gentle stops, abrupt stops? Because each one of these changes in the equine movement will change the response of the patient. And that's what we're looking for. How does the patient respond to what we are doing or asking our horse to do in order to get the result that we want? And although it's not in the description, I do want to make some comment kind of related to neuromotor and cognitive. Therapists work on impairments, whether they're PTs, OTs, or SLPs. What's an impairment? An impairment is a deficit in a system. A system can be respiratory, circulatory, neurologic, musculoskeletal. It can be vestibular. We work on where are the deficits, where are the lacks. And then if there is sufficient deficit, then we have a functional limitation. What's a functional limitation? A functional limitation means that it affects our ability to do something in our daily life. So we may all have a deficit, but if the deficit isn't sufficient enough and it doesn't really affect how we do things, then we don't have a functional limitation. So I think hopefully that gives you some background of what hippotherapy is. Go ahead, Lori.
Thank you, Bonnie. I also want to say that if anyone has any questions, if you put them in the chat, and we'll get to them towards the end of the session. But what we'd like to do is give each of the panelists a chance to talk about what they do and how they use movement and how hippotherapy is incorporated into their practice. So do you want to start first, Lauren?
Sure. So as an occupational therapist, I incorporate equine movement when possible into my treatment sessions. I always do a warm up. I love to just look at that alignment, one of the great things about incorporating horses is that you're automatically going to be able to look at midline alignment. It's easy to facilitate weight shift across midline, visual shift across midline, and those are all important things that we look at in occupational therapy. Also, just activating that core is so important to work on those fine motor skills that we focus on. So those are kind of basic things that I look for. Another important aspect of equine movement is the sensory input. When you put somebody on a horse and the horse walks forward, you're getting a lot more vestibular input. You're getting more proprioceptive input. You're getting what could be for your client normal visual flow, and all of that is integrated. So you're getting all of that sensory input. It can be quite regulating for a client. And so those are kind of, in a nutshell, what I do as an OT and when I'm incorporating equine movement.
Thank you, Lauren.
Mhm.
Beth, would you like to talk about speech and language pathology?
After Bonnie talks about PT, because I want to
Okay,
build
okay,
on
all
both
right.
what Lauren and Bonnie say.
Okay, Bonnie,
Okay,
you're
fair
up.
enough. Okay. Just before I talk about PT and using equine movement, I want to go back. Lori had asked whether we wanted to make a comment about hippotherapy versus adaptive riding. And I know for PATH it's therapeutic riding, but in all the literature from AHA, you're going to see it as adaptive riding, which is really kind of closer to what's out there in the world. It's adaptive skiing, adaptive bowling. It's more consistent with the terminology that's used for people that may have deficits or disabilities that choose to participate in sports or activities. So the difference also is hippotherapy is a medical treatment. We have patients. Riding instructors have students or clients. So that's a big difference. My goal when I'm using equine movement would be the same goal I would have when I'm in a clinic. For a riding instructor, the goals are educational goals. It's teaching a skill. Can somebody ride? Can they turn a horse? Can they do whatever we would do in riding? Where you sometimes see an overlap is in tack. So a therapist may choose to use a saddle or choose not to use a saddle. They may choose to use reins because they're using reins to teach right-left discrimination or grasp. So the intent is different, although sometimes the tack is similar. So hopefully there's kind of an understanding there. All right, now I'll go to as a physical therapist. Lauren covered so much of what we do, and there is a huge overlap in the three disciplines. But I think the reason Beth asked me to go first before her is that in order to be able for somebody to speak or to communicate, the patient has to have a certain amount of balance and alignment. If I can't get a patient to sit up straight and they can't take a deep breath, they're not going to be able to have the volume to vocalize or to be able to say words. So for PTs, very often we work on alignment, we work on coordination, we work on motor planning, all of which are aspects of speech and language. We work, as Lauren said, midline orientation, body schema. We work a lot. Although my intent is not necessarily to work on the sensory system, I can't ignore the sensory system because that overlaps, again, on the response my patient have. And just quickly, also on the limbic system, which has its area of arousal, because if somebody is hyper aroused, they can't pay attention. If they have low arousal, the same thing, they're not going to pay attention. So that's another big area that all three of us work on. And I think that kind of gives a general background of PT. So very often the physical therapist may get the patient, quote, ready for adding on the sensory part of it or getting them ready for the speech part. Okay, Beth, your turn.
Well, I like to go after my wonderful OT and PT friends because for people who are new or trying to understand how to incorporate the movement of the horse, the easiest way to see it is in physical therapy. because they are directly involved in the movement of the horse, facilitating particular movements of muscles, coordination, integration of the body. And we see it when they get off the horse and they're walking straighter, better, more symmetrical, etc. It's easier to see. Followed by OT, we're doing a lot more fine motor and cognitive and left right and different things. And if you look for it, you can see it and understand how the horse's movement is applying to that. Then we come over here to speech and language and swallowing, and you're like, what the crap? How is it even going to, what do you mean it helps with that? So you have to back up and look at the entire nervous system, where I'm not as concerned about how the horse moves and opens a particular muscle, except maybe for breathing. And I'm working on opening the chest to get better breath support. But I'm looking overall at how that horse with a good, symmetrical, wonderful nervous system is providing very systematic, repetitive sensory motor integration to the nervous system of the client, the patient on the horse, which teaches that nervous system how to work better, how to integrate better, how to understand, give itself a foundation. So when I add my skilled therapy on top of it, I get more than I can in any other environment. And when we look at that nervous system, it can be everything from working, increasing attention and arousal through the limbic and the reticular activating system. So the patient's brain is ready for increased mean length of utterance, adding words, is ready to comprehend maybe more complex sentences, is ready to work on the two fastest sensory motor coordination activities that you do as a human is speech, connected speech, and swallowing. And we see immediate applications to motor speech almost immediately, as well as practicing swallowing while the person is on the horse. And I am modifying that horse's movement to create the increase in the neurological integration for those sessions. So even though it's not as easy to understand or see as it may be with PT or OT, it is equally, if not more critical within the speech, because we um, rarely get, I don't think there's any other type of treatment strategy that is inherently as interprofessional, because even if I don't have a PT or OT to help me with one of my cases, that movement of the horse is still benefiting the entire nervous system. So they may see a little better walking after my speech session, even though I didn't target walking, just because of the movement of the horse facilitates that entire nervous system. It's just we are adding each of our skilled therapy on top of that and modifying that movement in the way that addresses our treatment goals within the scopes of our profession.
Thanks, Beth. Bonnie, you mentioned adaptive riding. Could you guys give some input? I know that we have riders that come in, or the people who are taking part of services, and how do you communicate to them? Because a lot of them feel like, well, riding is riding. They can just come in and maybe less expensive. Why should I pay more money for therapy? How would you communicate to them the difference and the importance of having that the hippotherapy piece?
Interesting question. Putting me on the spot here. Okay. So in most facilities, the therapist, be it PTOT or speech, does the initial evaluation. And therapists are bound by their disciplines, and again, as I mentioned, ethically to evaluate a patient and then decide whether the patient has sufficient, again, deficits or functional limitations where therapy would be beneficial. If a therapist during their evaluation deems that this is so, then the recommendation would be therapy. And then it becomes the responsibility of the therapist to explain to, very often, if the patient's an adult or the parent, if they're bringing in a child, that therapy is warranted and these are the goals that I would have. And if in some cases you reach these goals, then riding as an activity, as a skill, as a recreation, as a competition, whatever it may be, is appropriate. And that's, for me, that's usually how I explain it. If I do an evaluation and I feel that this particular person would benefit from the social aspects, the physical aspects, maybe being in a group environment, because riding lessons are very often group as opposed to therapy, which is traditionally one-on-one, although it probably may not be always so in speech and language, then that would be my recommendation. And we have to kind of get away from money is the factor, although obviously we have to be cognizant of it. But ultimately, you want the best environment for, like I said, the person or their child. And it's dependent, I think, on the recommendation of the therapist. And sometimes that's a hard sell. But
Yeah, and I'll follow up on that and
Go ahead.
say that, I have some of my speech therapy clients who also are in adaptive writing. And the way that I explain it is look at what the main purpose is of the session. The adaptive writing is recreational activity. They're learning to ride a horse. The side effects, the secondary effects, is that, oh, they may see some improvement in physical abilities and in reaching in speech, but that's not the reason that they're going to those sessions. And the opposite, when they come to PTOT or speech incorporating hippotherapy, our treatment goals are the primary emphasis. And the fact that they're sitting on a horse and think they're riding, coming to see their horse, is a secondary piece. And the main questions for people to ask is who is in charge of the session and what are the goals of the session. And once they see that, then this is a writing lesson with an adaptive piece, and this is a therapy with a therapist who's gone to 6 to 7 years of higher education to learn how to do this. And many people will look at adaptive writing mainly for the financial reasons, because it is less expensive than coming to PTOT or speech. But I think as we all move to, raise the bar higher across and advocate for why equine assisted therapy, hippotherapy is so effective, I think it will begin to be more of an option for more people.
If I could
Lauren?
say something, I always ask people, what are you interested in? Are you interested in learning to ride a horse? And if that's the case, then here are the riding instructors. Does your child need therapy? Are there specific issues that you want to work on and develop skills? And if that's the case, then, I'm going to evaluate them. And so I like to talk to the families and find out what their goals are. And sometimes their goals are riding. Their goals are explicitly, I want my child to be around horses and to learn about horses. And they're going to get a little bit of that in an occupational therapy session, but they're going to get a lot of that with riding. And so that's kind of how I differentiate it. I also, when people come to me for occupational therapy, I do like to give them a tour of my facility, because my clinic is very different than the hospital down the street. And I want them to understand that this is therapy in a barn, and it is different as well.
As a riding instructor, I know that this seems to be buzzwords with people who want to come riding. They'll see that we're the only riding place, or it's the only riding place in the area, and you'll ask them what their goals are, and they'll write therapy goals. Even they need that education of what happens if there isn't a therapist. How can the instructors connect with a therapist? We talked about calling. Is there a way of getting input? Because they'll put need better midline or improvement, or just therapy terms on their goals, and you have to kind of redirect them. I don't know if you just while we're on that topic, any other thoughts of how you could connect people with therapists, or what happens if the riding instructors are doing the evaluations and there isn't a therapist? Is there a network we can tap into?
Absolutely. The American Hippotherapy Association website has a Find a Therapist tab, and it lists therapists in all the states and many other countries. I think that's a great place to start.
So as we move on into more into the hippotherapy itself, can you tell me or tell us what does the whole treatment on the horse look like? It is all on the horse? Is some of it off the horse before you get on? What does it look like?
You want me to start that?
Sure.
Oh, okay.
Go ahead, Bonnie.
So it's important for people to understand that they're coming to us for as a physical therapist, an occupational therapist, or a speech language pathologist. That the therapist then makes the determination of what's most appropriate and what will be most effective to treat this particular patient. So it's hard to give a specific example because it's so patient driven and dependent. And the answer is hippotherapy, because it's equine movement. That part of my PT session would be the part that the patient is on the horse. I may do a lot of off horse activities. That's not hippotherapy. Okay, that hippotherapy is a treatment strategy. All of it is physical therapy for me. I'm always doing physical therapy. The tool that I choose to use defines whether at that time it's hippotherapy or whether it's kind of a more traditional type of PT, for lack of something else. So, Lauren, do you want to?
Absolutely. So, anybody I'm meeting for the first time, I always explain hippotherapy is the equine movement portion, and it is part of our treatment plan. We may have horses as part of the session. We may not. Sometimes there's safety reasons that we can't integrate a horse into therapy. And so I try and be as clear as I can when I'm first meeting people, when I'm evaluating clients. And so the hippotherapy part of a session, like it is very client dependent. And I try to put it in the beginning part of the session, but is never the full session. It is part of my treatment plan. I always probably am doing some type of ADL prior to climbing onto the horse. But the equine movement part is also very important to the session. And then and then they get off the horse, but I love to develop a relationship between my client and the horse. I think that's another really important part of occupational therapy, is developing those social parts, the pet care, things like that with a horse. So while equine movement is an important part, it's not the only part. And there's many things to do for us in the barn because it's so occupation rich. I feel like I've kind of gone tangentially a little bit, but I agree with Bonnie. There's no way to describe what hippotherapy looks like in a treatment session. There's no one way to describe it.
And
And
I'll
Beth,
just,
go
again,
ahead.
we'll take what they say and just pull it over because it's the same here. We are providing speech therapy. That's the main picture. And if you look at like a series of umbrellas, the big umbrella is speech therapy. Under that is equine assisted therapy, where you're incorporating the horse at some degree. You could be on the ground. I may have some kids who are following directions and learning how to put feed in different buckets for different horses. And so we're still incorporating the horse, but not on the horse. And then under that is hippotherapy, where it's that movement piece where we are directing what the horse is doing to address our treatment goals in the session. So it builds on itself. And that final piece can be very different for different speech therapy clients based upon our goal. Is it a voice goal? Is it fluency? Are we decreasing stuttering? Are we working on increasing articulation and intelligibility of speech, understanding of language, following directions, social pieces, using an AAC device? But that final piece is, how am I changing the horse's movement so that I'm facilitating my skilled therapy techniques on top of that horse with the client toward their speech goals?
So I would be safe to say that it's pretty a good use of critical thinking. You need to look at what you see in front of you and change whenever you need to change and do what is needed to be successful in a treatment
Yeah,
session.
exactly. Because the other wonderful piece about hippotherapy is that we have different horses. So I can
Yes.
make a treatment activity harder or easier for my client just by using a different horse
Mhm.
or by changing that movement piece a little bit differently than I did before, but I'm using my same skilled therapy activities. And I love that. Sometimes the
So it
child
looks
doesn't like,
different every
where'd
day,
my
every
horse go? I'm
session.
like, different horse. We're good.
And with that, is there a do you think there's a better dosage? I mean, should therapy provided once a week, every day, or is there any research that you know of, or what is your recommendation? What is best, or what do you think is best? I
Uh,
guess we'll start with Bonnie again, since
Oh,
you're
thank
you're
you,
always first.
Lori. Ah, that's a hard one to answer. It's again patient driven. I mean, realistically, there our patients are working very hard to stay on the horse. So even though it doesn't very often look like they're doing much, they're doing a lot. Every day, I've never had a patient where I thought every day would be productive. So, um, most cases, we see our patients for the hippotherapy part of it once a week. Some places are lucky enough, maybe twice a week. Again, it depends on the patient's tolerance, on their endurance, on their ability to be able to tolerate more than that. That being said, um, if you adhere to motor learning principles and motor theory, one of the parts of the theory is that it takes a while once you've learned a skill to incorporate a skill. So sometimes only coming once a week is good because it gives you time in that interim portion to find out whether you've learned the skill and whether you can reproduce it. And so I'll take an example for me. I live in New York. The weather is cold. I didn't ever treat because of the types of patients I saw in the winter. I mean, first of all, you couldn't see what was happening with their spines in fluffy jackets, and everybody was all curled over because it was so cold. And I always thought like, 3 months, it's going to be 3 months from December to March. They're going to lose everything that we've done. And it was amazing how many people the 3 months off incorporated what they had learned and came back and were able to do it. So again, dosage is a very hard thing to answer. And I would say it's so patient driven. Best I can offer on that topic.
Any, Lauren, or would you have anything to add, or Beth?
I agree. I've seen kind of the same responses that Bonnie has seen. I do treat year round. I'm in Delaware. We have kind of fairer winters. So I think I think there's a little bit of evidence about dosage, but most of them are kind of short term. I think there might be one or two studies about intensives where somebody would come maybe 4 or 5 days a week for 3 weeks. I'm not set up that way. I think that it would be great if I had tons of flexibility to do some intensives. I would love to kind of look into that, but I think also we're limited a little bit to how we're set up. Sometimes I will see clients twice a week, but generally I see them once a week.
I think it varies too according to, again, the client, what they need, what the purposes are. I will say that I feel very blessed because my private practice is in a path center that has a heated indoor arena. Heated for this Florida girl is a very different definition than what they say is heated up here in Michigan, but at least we get to do it most of the year. And I offer a speech camp, which is 3 hours of therapy a day for 4 days straight, an hour of which is hippotherapy with the horse. And we see such amazing progress in those 4 days that many times that's how the parents see, oh my gosh, they did something new today that we haven't ever seen before. And like, yes, because here's what the horse did, here's what we're doing. We have the off the horse time, we have all of this. And then after the 4 days, they're like, you have a client for life because we've seen what it does. The research has shown that for clients who come once a week, it takes around, I believe it's 8 weeks to see carry over to the next session. So if you truncate that coming more than once a week, you would see that in a shorter timeline. So I think it's also a matter of, well, also insurance. Will insurance reimburse 2 to 3 times a week versus one, and that piece. But I think you do what you're able to do within your own practice, and make sure that you let them know that for children or adults who are just starting, because I work with adults too, who are just starting the movement of the horse, once a week is enough physically for many of them to handle, and then you can build on that if you need to later.
Right. And I just like to make one comment, kind of builds on what Beth said. We have to take into consideration the level of impairment that our patient has. So maybe for a speech therapist, if there aren't a lot of physical manifestations, then yes, being able to be on the horse 5 days a week or 4 days a week is appropriate. If you have a patient that has a lot of involvement in a lot of their systems, then that may be too much. It's not giving them a chance to rest and recuperate so they're ready for the next one. So again, you have to evaluate your patient and know where they're at, where you'd like them to be. So again, there's no recipe of X amount of days or X amount of time. And to go back to what Lauren said, there are a lot of studies now for physical therapy, and I'm going to say in a traditional setting, which let's say is a hospital, where intensives are really important, real heavy duty exercise for a very short period of time, because that's what patients do best with, instead of us coddling them. But I'll go back to saying we have to remember how much work it is for a patient to stay on a horse, if we're not holding them on the horse and they don't have tact to help them hold on. So that's the other piece of it that we have to consider in terms of intensive versus if I was working in a hospital or clinic situation.
So I think you guys have brought us right back to critical thinking and clinical reasoning, which is very, very important through all three of the disciplines. Well, I would say is important in all of it, and adaptive riding as well. Beth, you talked about the horse. Let's go to the horse for a little bit and talk about maybe movement, what knowledge is needed about the horse. What do you look for? What's your favorite breed? Any of those topics. Let's get on the part that makes this work, right? The horses. Without the horse, we would not have any of it. So,
Well, I love that we have options in the horse world. And being someone who's 5'3", I like my 14, 15 hand, 13 to 15 handers that walk like a horse and not like a little pony stride. And I like the horses who've learned how to use their bodies correctly. I prefer a horse that has had training and how to use its body, because that's what I want in my session. So my favorite horses have been those who have been through dressage training, reining training, just some type of professional training where they are they understand what they're being asked to do, and aren't well, not like weightlifters, but they're not the ones we're going to pull in off the street who had no exercise in their life, and now that's I don't want that movement, that horse who doesn't really know how to use their bodies correctly in my session, because that's a big piece. But then I also want to add, it's not just the horse, it's who's leading the horse and how they're leading it. Because the horse may know how to use the body, but if the leader is just pulling them along, I'm not getting the quality movement that I want for that session. So I think there's multiple pieces. It's not just the horse, it's how they're led, how they're moving, how the safety sidewalkers are being intrusive and talking to my client when they're not supposed to. You're there for safety for this reason. You're not talking. For another one, I'll let you talk to them, but for this one, I need you to just walk for safety. And so that's part of the critical thinking piece is why this horse? What tack am I using? How many volunteers do I need for safety? And how is the leader going to lead? Are they going to be up front? Bridle, halter, how are we leading, or are we long lining from behind? How am I going to get the best quality of movement? Typically at a walk, but we occasionally do a jog or trot in my sessions. And so all that comes together. So, and then there's the size of our client. I can work with itty bitties on a 13-hand pony beautifully, but next thing I know, I have a 6'4", 18-year-old with autism, who needs a Mack truck type of horse. That I may not be comfortable working with because they're way up there and I'm way down here. And if something happens, I'm going to get them off the horse, at the expense of my body, and I'd rather not do that. But I think the wonderful thing about horses is that between the different breeds, the different sizes, we have a lot of options for, again, making our sessions more challenging for our clients, as well as backing off a piece and using a different horse. And for the communication piece, if we use the same horse repeatedly, that client and the horse will begin to build a relationship, which also improves the communication. Because many times we'll have our clients who will initiate speech with the horse before they may do it with a person. I think they're just, it's not just about the horse. It's that critical thinking piece of what horse, how are we doing it? What does that session look like for this person? And then realizing that some days they may show up and it's not all there. And so we're doing something alternative because we still need to provide our therapy, even though the horse may not be available.
Okay.
I agree with Beth. I don't have a favorite breed. I work with probably medium ponies up to cob size horses. I have 6 that I use on a regular basis. The horses that I use have a high level of training. They probably, I would say it's comparable to like a second level of dressage. They have lateral work. They are adjustable within gaits. They're able to provide a slow walk, a medium walk, a more forward walk, in all the gaits, but the main gait that I use as well is just the walk. My horses are fit. If I'm not using them for therapy, then they're out jumping jumps in the field or doing dressage in the dressage arena. So I think I'm very lucky at the farm that I'm at with the quality of training that the horses receive before I even look at them for therapy. And then just the activity level that the horses that I'm able to use receive just in their life. But I use all different breeds, although the farm seems to be getting a lot of halflingers lately. So I may be incorporating more halflingers in the future, which I'm excited about.
Bonnie, do you have anything to add?
Just a little. AHA says that hippotherapy is for the horse is an equine discipline, and I love that they made that decision because it's true. We train horses for dressage, we train them for jumping, we train them for barrel racing because there's a job that we expect them to do. And in therapy treatment sessions, the expectations are that our hippotherapy horse will be able to do things. They need to be balanced. They need to be able to stay straight on the bend of a circle. They need to be able to lengthen the stride to shorten the stride. So those are all expectations that we have. Certainly temperament above everything else is important. So I would say that the horse would have to be able to fit within the parameters of what you need them to be able to do for your patient load. And I'll make a comment about breeds. I really don't like it when people are breed snobs. I think you have to look at the horse and what their abilities are and their temperament. When I first started using horses, it was like, oh, I would never use a gate. It wasn't me, but it was like, I would never use a gated horse. Why would you use a gated horse? Well, if you have
Oh,
any,
I love gated
I
horses.
know. So if you have any experience, I'm going to take a Tennessee Walker. They have the most amazing walk. They have a natural
Yes.
overtrack. And we know our kids love speed. And what happens with speed? Their heads are bobbleheads all over the place. What does a gated horse do? They can move faster with no vertical displacement. So again, you need to look at your horses, look at their skill level, what they're good at, and then match them to our clients' needs. And one quick question or answer maybe about gender. I love mares. And I know a lot of people don't love mares. And I know the issue about doing it in groups. Yes, okay. My feeling is the mare is not the problem, it's the boys that are the problem. Geldings can't keep their heads on straight. So again, I wouldn't turn away a really good mare. I think you have to look at the horse and the quality of movement, temperament, size, all the other parameters. That's my spiel on horses.
Okay. So you're all talking about that your horses are highly trained, and Beth, you said that you would like to get them that way. And we all know that that sometimes is not as easy. So do you work with an equine professional that you work with to find the horses, to train the horses? How do you keep them in exercise and trained? Do you all do it yourself because you're all both horse people and therapist? But if you weren't, how would you make that happen? How, do you yourself work with an equine specialist, or you do it in house? Did that question make sense?
That makes sense. We may all answer it a little bit differently. I feel fairly skilled in long lining, starting a horse in long lining, basic training. I'm not an advanced trainer by any means. So most of the training I feel comfortable doing myself. If there was a problem with the horse, then maybe that horse is not appropriate for my needs because safety may be an issue. If I have a question, yes, absolutely, I will reach out to a trainer who understands what my needs are, and together we would problem solve whether this horse is appropriate and the movement is appropriate. I feel very strongly that therapists that are incorporating hippotherapy should be strong horse people. And I'm going to make a comment about just because somebody is a very skilled rider does not mean they are a very skilled trainer. So if you're going to look for help, you need to look for somebody who knows how to train horses. They could be a medal McClay rider and have lots of medals and done well in competitions, but that doesn't mean that they taught the horse how to do it. So again, I would look, if I don't think I could do it, I would look for a trainer who can.
Well said. Any input, any additional things, Lauren or Beth?
Sure.
Beth?
My clinic is like I said, it's at a barn, and I work closely with kind of the lead instructors. They kind of know what I'm looking for. And if I have training questions, I always go to them. I also have skilled horse handlers. Beth brought that up. I think that's super important. So I don't just take a horse from a riding lesson and put it in hippotherapy. It's a long process. We just start working with it. I have my horse leaders work with it. Once I have an idea of, or I have my eye on a horse who's got that movement, who's got that ability to handle unexpected behaviors, and has that training, then that's when I start bringing it and looking at it as a potential hippotherapy horse. And like I said, I work with the riding instructors, I work with my horse leaders, I'll work with it myself. We kind of have a lot of different people looking at the horse and kind of taking that critical eye and looking, is this going to be the right horse for us?
Yeah,
Beth?
and I'll add that I love the idea of hippotherapy as an equine discipline. And I wish that we were able to expand that and have people say, gosh, let's train this horse for hippotherapy. When I was in Alabama, the son I worked with had 3 mares who got themselves pregnant. Just don't ask why. And there are 3 best therapy horses, and they dropped their foals and were right back in the sessions with the foals beside them. Those foals grew up in the equine therapy realm, and were involved in ground sessions before they were, working with riding, and grew up in the therapy realm and were some of the best therapy horses you know, we had. And so after seeing that, I'm like, why are we taking everyone else's leftovers and bringing them over and teaching them a new skill when it could be its own discipline? Because some of the horses we have are wonderful, but have too many buttons. And I have a lot of kids with a lot of movement. And, and when they get a little kick on the side, the horse is thinking, well, you're telling me to do something. But no, we're really not. That was your previous life. And so there's a balance in what's happening. But I think we have to evaluate each of the horses just like our clients individually. Will this horse work for my session? And just because they're a part of an adaptive riding program does not mean that they're also applicable to a hippotherapy session. There are different criteria for the adapted riding horse versus the hippotherapy horse.
Several of you or all of you mentioned the importance of the volunteers and the leaders. Do you find that you have trouble implementing that? I know some programs have also even gone to paying their leaders, so there's consistency. Does anyone have any other comments before then we can go into questions? But do you have any comments more about the leaders or the volunteers or the helpers? Or do any of you pay your leaders?
I do.
You do.
Absolutely.
I have also in the past, definitely. Yep.
It's a skill. It's an important skill. They need to know my horses, and the horse professionals that I use, they know the horses in therapy, and that's their job. So.
Right. And part of the therapist critical thinking is, okay, I have a leader. I may think something in my head, but I've got to speak it so they know exactly what I want. I can't expect them to read my mind about what the horse is doing and why I'm doing it. So I have to be very vocal about when to do something, what I want the horse to do, how to modify it, and whether it's working or not working during the session. And then sometimes, afterwards, give a big hug and say, okay, I know that was rough, but we did it. And now you know more about what I'm looking for in the session with this horse.
I would just add on to both Lauren and Beth's comments is that it behooves, and it should be the therapist who trains the sidewalkers and the leaders that are going to be part of their session. Because then, yes, you have the same language, you understand when you say you want to do something, but you also have trained them in safety procedures, in handholds, where you want the grip, what you want done. So it should not be left up, even though you have very skilled, let's say, riding instructors. They're not going to be necessarily part of your session, and you want your group, your support group, to understand exactly what you want and how you'd like it done.
Okay, so I think we can move on to questions. We have about 10 minutes, and we have a couple in the queue now. I don't know, Marnie, if you want to. We talked about you taking on the questions, or I can keep going if you want. Whichever.
No, we can do questions. We're good.
Yeah, no, well, Marnie was going to talk about them. We were split it up, and I'm just asking her if she still wants to do that, or if she just wants me to keep going.
I will read what's in the comments.
Okay.
Hugo said that sometimes I see the financial piece opposite of what was inferred. Medical insurance will often cover therapy incorporating hippotherapy, but not adaptive riding, which becomes an out-of-pocket expense. So sometimes actually the therapies can be cheaper because insurance will pay for a certain amount of those. And then Anna S. said, people living with autoimmune disease like multiple sclerosis, rheumatoid arthritis, Crohn's, and others often have impairments that aren't physically obvious, i.e. pain. How does hippotherapy address these invisible impairments? I'll let you guys answer that one.
So I think it's important when somebody comes to a therapist, they have a need for occupational therapy or speech language pathology or physical therapy. So if your impairment is pain, a goal might be to decrease your pain when you're dressing or walking or something else. So we may integrate hippotherapy to decrease your pain, but once again, we're looking, you're coming to me for occupational therapy. Hippotherapy is going to be part of your session. I'm going to look at your signs and symptoms, your physiognomy, how you move. I'm going to make the best decision I can about what the appropriate horse is going to be. Hopefully, it might be pain relieving for you to experience that equine movement. It might be just long, straight lines of, that rhythmic walking that does decrease your pain. It may not. I'm going to have to kind of make that adjustment as we work together, but it's important for people to understand that when they're coming to me, they're coming for occupational therapy. And so there may be something else that we can do that's going to decrease your pain.
Mm-hmm. And if you want to look at the neurological underpinnings of that movement of the horse that we select provides very gentle mobilization of joints that can reduce pain. That movement that facilitates the whole nervous system, it activates the sympathetic and parasympathetic nervous system that can reduce stress and fatigue, while encouraging endorphin release, improving mood, which will also help decrease pain. So there's a multifactorial use of the horse to those, like you said, indivisible, no, not obvious impairments, including the pain and fatigue management, physical regulation, like in multiple sclerosis. That is, a brain-based disorder. So anytime we're facilitating the nervous system moving in a very effective manner, we're going to help with the implications to MS. Emotional autonomic regulation in many of our kids. Many of our kids will finish the session and actually have a bowel movement over the next day because we've activated the system, even though that's not a goal of my speech therapy session, but just kind of what the horse is providing. And anytime we get core activation, breath support, the social psychological impact of being with people who are supporting them, all of that can address the invisible disabilities.
Bonnie, you want to add anything?
Just a short thing. When we make a decision and we evaluate a patient, we always do an on-horse evaluation initially. And so if pain is a factor, and that's one of the areas that our patients are concerned about, then we need to, when we do the on-horse evaluation, assuming that is the appropriate size horse and other factors, did we make the pain worse? Did the pain feel better? Get back to me in a couple of days and let me know how you feel 2 or 3 days from now. Obviously, if the pain exacerbates, then this is not a treatment strategy that's appropriate. And if a patient is verbal, then they can give you that feedback. It also behooves a therapist to be really good at reading body language and facial expressions, because sometimes I've had patients, and I'm going to use MS as an example. How are you doing? Okay. How do you feel? Okay. I'm seeing they're turning white. They're grimacing. That would be not my definition of being okay. So it's a combination of actual feedback you get verbally, but also your ability to read somebody's face and body language. And the goal obviously is not to make pain worse. So that's a consideration.
Okay, there's a couple more comments, I think.
Yep, there is. Love the description of the difference between riding lessons and your roles. I also love how knowledgeable you are concerning movement and balance of horse and relationship with the horse handler skills. I wish a description of equine welfare was also included with as much attention.
Well, I'm sure that you all can go we talked about it before we got online.
Right.
So anybody want to comment?
I'll start.
Yeah, okay.
So think that equine welfare is becoming more of an optic, an important optic in a lot of the horse associations and certainly the American Hippotherapy Association. As an occupational therapist, any skilled licensed therapist, we are ethically bound to provide the highest quality treatment. So if we have a horse that isn't feeling well, is lame, is sick, we are ethically bound not to use that horse. I think as therapists with training to integrate hippotherapy, I know the training talks about equine well-being, and I think that just it's inherent in our professions, and probably our license depends on in integrating healthy animals into our practices.
I would like to make a comment also that equine welfare, there are aspects of it are the physical aspects and maybe the emotional aspects or mental health well-being of the horse. And we have to look at, is the horse not appropriate because they're not trained or physically fit for the job that we're asking them to do? But also to me is maybe this is a job the horse doesn't like. And so the equine welfare piece becomes not maybe that the horse isn't fit, but maybe we're asking them to do something they really don't want to do. And that to me is also a huge area of equine welfare. Reading the horse and saying, maybe this is not your thing.
Well, I'll say too, I have fired therapy horses, and sometimes they fired themselves, where they wouldn't come out of a stall when a certain client was ready. They're like, nope, rather not work with them. We're the ones with the physical disabilities. I'd prefer not to work with the ones with TBI or autism. Seriously. So being able to like critically evaluate the horses that you use and why they're there and what's a piece of it, and that sometimes they're just done, they need to retire, they need another job with everything else. So I agree with what Lauren and Bonnie have said too.
Just a quick comment too is there's so much on social license and use of words and everything. I know there's things that like kick people off as far as the use. I've heard use, but I think I also in the therapy world that is it's not a modality. It is a use of a piece of equipment to get the payment, right? No, tell me more about it. Lauren, you were shaking your head no.
Yeah. So I just read the comment and I absolutely agree with the commenter. I mean, the horses, they're our partners. I know I probably said use, and that was a faux pas, and I'm sorry because I don't consider I'm using the horses. I'm integrating them. I'm partnering with them. I absolutely want them to be happy and healthy. It only makes for a better treatment, a better outcome for everybody involved. So 100% I agree. We're partnering with these horses, and it really makes for something wonderful and special and something that you cannot duplicate anywhere else. And I feel like that's why we're here.
Yes.
Yeah, I know. I just know there's like a word mind out there, and I've learned so many words just that I never even knew existed. So it is interesting, and even trying to write and cover all of that. I also want to say that Beth is inviting everybody for a weekend vacation.
Yeah.
If you want to look in the comments, you can see that it's looks interesting. Okay, so I think we're about at our time, right?
Yeah.
Do you any of you want to make a last comment? I would like to just say something first, in that the critical thinking and the clinical reasoning keeps coming up, and I think that's important in the EAS industry in general, and I think that it's lacking in some areas right now. So I appreciate how much you really talk about that, and that everything is different. We have to evaluate it and look at it and make educated decisions. Do any of you want to make a final comment or say anything? Or are we good? We're good.
I think
Just
we're
learn
good.
and grow. Learn and grow. There's always someone out there who's ready to answer questions, to help you along, to mentor, to review videos, to help you in the process. So learn and grow.
And I think I like what we talked about in the beginning, how Bonnie had a question and she sent you videos, Beth. I mean, the fact that you can work together, if
Mhm.
you have questions with and work with other therapists, you know, that whole collaboration piece is so important nowadays.
Well, thank you all. This was, I hope the audience enjoyed it, but I had a great time. This was a lot of fun.
There's
We'll
Yeah.
have to do it again.
there's lots of thank yous in the chat. Lots of thank yous.
Yeah, maybe we'll have a part 2 piece.
Yes.
I'm very excited and so appreciate all of you doing this panel. It was something that I felt like needed to be addressed and explained, and y'all did an awesome job at doing it. Thank you, Lori, for moderating, and Marty for doing the chat room. So again, thanks to all, and the recording should be up soon.
Thank you so much.
Thank you.
everyone.
Thank you.
Care.
Have a great
Bye.
day.
Bye.
Pleasure.